Hey there, welcome back to Ask a Doctor, the series where we peel back the curtain on the medical world and answer some of your burning and some funny questions from Quora and Reddit related to healthcare and doctors. I'm Dr. Priyanka, and today we got some juicy questions. Let's start with some burning questions. Number one, what is the scariest disease in the world? So there are several diseases that are considered frightening due to their severity and potentials for widespread harm. One such disease is Ebola, which causes severe hemorrhagic fever and has high mortality rates. Other diseases like HIV, AIDS, cancer, and neurodegenerative disorders can also be frightening due to their impact on individuals and society. However, it is important to remember that advancement in medical science and healthcare have improved our ability to prevent, treat, and manage these diseases, offering hope and better outcome for patients. Second question is, what is the best treatment for Parkinson's disease available currently? The treatment for Parkinson's disease typically involves a combination of medications, lifestyle changes, and sometimes surgery. The main goal is to manage symptoms, improve the patient's quality of life. The most commonly prescribed medications for Parkinson's disease are levodopa and dopamine agonists, which help to replenish dopamine levels in the brain. Other medication may be prescribed to control specific symptoms such as tremors or stiffness. In some cases, deep brain stimulation, DBS surgery may be recommended to help control symptoms that are not responding well to medication. It is important to note that treatment plans are tailored to each individual's need, and consulting with a healthcare professional's second opinion from neuro expert is important. And you can do so now and remotely talk to the world's best neuro experts in the USA through MediPocket USA for proper diagnosis, personalized treatment plan, and management. Now, this is a good one. Do you think addiction is a disease or a choice? So number one, addiction actually starts with a choice and then it becomes a disease. What I mean is addiction is considered a complex neurological disorder that involves both biological and environmental factors. While initial substance use may be voluntary, addiction alters the brain's chemistry and impairs decision making, leading compulsive drug seeking behavior. It is important to understand addiction as a disease to promote empathy, comfort, and effective treatment strategies to the patient. Now let's switch some gears and do some funny ones. This is good. Do doctors secretly write notes in patients' files that are shared among other doctors but are not accessible to the patients? For instance, might a doctor write that a patient is difficult or dramatizing their illness? Okay, the short answer is yes. Doctors do keep notes, but it's all about providing the best possible care. Now let's jazz it up. Imagine your medical file as a backstage pass to your healthcare journey. Doctors are like rock stars of healthcare, and this is where they jot down the behind the scenes stuff. But fear not, this isn't some secret doctor diary filled with high school style gossip. Doctors document your health history, test results, and yes, even their observation to ensure you receive the best care possible. So if you ever wondered, could my doctor be calling me dramatic behind my back? Well, doctors aim for professionalism, and they are not there to judge you or spill the tea. They write these notes so they can understand your unique health puzzle and make informed decisions. So there you have it, folks. Doctors keep notes, but it's all for the greater good of your health. They are not plotting against you, and they are certainly not handing out drama queen awards. Remember, it's all about providing the best care to you. Another question is, do doctors visit other doctors when they fall ill, or do they prescribe their own treatment and medication? Doctors, yes, they are superheroes in white coats, right? But even superheroes get a cold and sick. Yes, they visit other doctors. Why? Well, it's not just about seeking another opinion. Even doctors need a fresh perspective and someone to look after them when they are down with sniffles. You see, doctors are amazing, but they can't give themselves a pat on the back and write their own prescription. Now, there's one thing that's clear. They may know the medical lingo, but they also know the danger of self-diagnosis. It's like trying to be your own lawyer in court. Sometimes you need an expert by your side. So when it comes to their health, doctors aren't flying solo. They visit other doctors, get those second opinions, and follow the prescription just like any one of us would. And you know what? It's a good lesson for all of us. If even doctors know when to ask for help, We should too. So the next time you're feeling under the weather, don't hesitate to see a doctor and seek a second opinion. They are experts for a reason. Okay, what is the best question to ask your doctor? The best question to ask your doctor may vary depending on your specific situation and health concerns. However, a good question to ask your doctor is, what are my treatment options and what are the potential risks and benefits of each? This question allows you to gain a better understanding of the available treatment options for your condition and help you make an informed decision based on your specific needs and preferences. Remember, if diagnosed with serious life-threatening medical condition, it is critical to take expert second opinion. And now you can do so from anywhere in the world and connect with the best minds in the world here in the United States. Seek a second opinion through MediPocket USA. This next question is, as a doctor or a nurse, do you ever have a scary gut feeling and turned out to be true? So medical professionals often experience gut feeling, those nagging intuitions that something might be off. Call it a sixth sense or years of training, but sometimes their instincts are spot on. So let me share my personal gut feeling experience. Back then when I was a young resident doctor in the ER, one day a 40-year-old gentleman was rushed in complaining of severe upper abdominal pain. His family thought it was just a result of indulging in some heavy, oily food earlier that day and labeling it as gastric pain and acidity. Even the patient himself was quite convinced it was a minor issue since he was generally healthy. But here's where it gets interesting. As a young doctor, I couldn't ignore that gut feeling, that whisper in the back of my mind that something wasn't quite right. You know, that intuitive nudge that says, dig deeper. Instead of jumping on the gastritis bandwagon, I decided to take a closer look. I ordered an EKG, a simple test to rule out one critical condition, a stem heart attack. I knew that in some cases, upper abdominal pain could be a deceptive messenger for something far more sinister. The EKG results sent shockwaves through the ER. The EKG showed clear signs of stem STEMI heart attack with an elevated STI segment and a T wave that was peaked than normal, sign of a total blockage of a major artery. Time was the essence. We sprang into actions. The cardiologist was called immediately and the patient received critical life-saving treatment in the nick of time. The gastric pain turned out to be a ticking time bomb, and thanks to that gut feeling and quick decision-making, a life was saved that day. This experience serves as a testament to the power of medical intuition and the importance of trusting your instincts when something doesn't quite add up. While science and evidence are our guiding stars in medicine, sometimes that gut feeling can lead us down a path of timely, life-saving intervention. This on a funny side, as a doctor, what was your now that was stupid moment with a patient? You see, doctors may wear white coats, but we are not immune to a good old-fashioned facepalm moment. To share a story that left me thinking, now that was stupid. Young doctor in the ER at that time I was, is where chaos and the unexpected are a bread and butter. A patient rolls in, visibly distressed, clutching their chest, classic signs of heart attack, right? But hold on, because this patient had a rather unusual explanation for their pain. They looked me straight in the eye and confidently declared, "Doctor, I've got this excruciating pain because I ate an entire watermelon in one go." The patient genuinely believed that the fruit feast had led to this chest-clutching ordeal. I couldn't help but suppress a chuckle, thinking, now that was stupid. I mean, watermelon's delicious, but it's not exactly a cardiac culprit. But here's the thing, folks. In the world of medicine, every complaint deserves a fair hearing, no matter how quirky it may sound. So we ran the necessary test to be absolutely sure, and unsurprisingly, the watermelon wasn't to blame. It turned out to be something entirely different. So that's all for all the questions today. Hopefully, you guys got the answer to some and laughed from some. If you have got more burning questions about the world of medicine, then drop them in the comments below. And we might just feature your questions in an upcoming episode. Stay curious, stay healthy, and remember, even doctors need doctors, and second opinion is critical. See you next time.